If you look at our system overall, no one is satisfied with the role that they play within the healthcare system. Providers aren't satisfied with the way the system functions. Patients certainly are not. Payers are not. It's interesting to step back and look in an environment like this.
Welcome to the Human in the Healthcare Loop podcast. I am Ramesh Kumar, CEO and co-founder, Zaki Point Health, and I am joined by Dallas Scrip, Senior VP, TPA segment, Claritev. Andy, Dallas and I are super excited to be chatting with you today. Dallas, you've known Andy for a long time. Why did you get this guy on our show?
And I'm still willing to talk to him, so that's a good thing.
It's the people make the day-to-day of any job or anything that we do enjoyable. And, I was fortunate to have the opportunity to work with Andy in the past at Value Health and learned a lot from him, and excited as we were kind of putting this together and bringing voices to folks that folks probably don't hear every day. Andy's story is very unique, and I think there's a lot that we can all learn from that.
Andy, how did you get into healthcare?
Well, so it was probably a little bit of luck. I'm following some good advice. When I was graduating from college and looking for, whatever my next step was, my first job, 2003 is when I was finally kind of taking that first job out of college. And a good friend of mine whose mother was a nursing executive at the local regional hospital was visiting with her. And she knew I was graduating, that I'd focused my studies in. I was kind of looking for, and she said, you should really look into healthcare technology. And I interviewed with every company that would come in. And I graduated from the University of Texas in Austin. So as you can imagine, lots of oil and gas, and that whole industry was really big. And Cerner, healthcare technology company, was just starting to recruit on college campuses kind of in that area. And so I interviewed with Cerner Corporation, had a great interview, received an offer. And oddly enough, the offer matched all the things that I had kind of identified, was able to experience over the course of the 17 years that I was there, a whole variety of different jobs. They had a real philosophy around organic growth. I felt like in the time that I was there, I got the experience of 5 or 6 different companies, kind of all within one, working within the different departments. And so was able to get a lot of exposure. It kept it incredibly interesting and fun, stretched me personally from a professional standpoint as well, and was really just fortunate to be in that experience, having several points collide and end up with me in healthcare.
And I know you were leading the charge on consumer experiences and doing a fair bit of work on how to engage patients. What did you learn from that?
As you look across the spectrum, people need healthcare at different times. So engaging people to proactively look at healthcare, you've got a segment of the population that are very interested in the data geeks. I have an Oura Ring and an Apple Watch, and I'm interested in every little data point I can get around my health. There's others that just aren't until they need it. And so how do you meet people where they are is one of the bigger challenges. And it's not purely blasting people with text messages or, different things. Everyone's a little bit different. They have their different motivations. They have their different stories. Meeting people where they are to be able to easily access the healthcare that they need is challenging. It's a constant journey that I think the industry's on and will continue to be on for a while, because there's not a single solution. Everybody's different. Everyone's unique. And certainly technology solutions have a big role to play in how to engage. It's difficult for sure.
On the payer side, we always have the same challenge, right? We talk about member experience and engagement specifically, especially as mobile applications have become more prevalent with regards to playing a key role in that experience. And the engagement rates, when we're all being honest, are lower than any of us would expect. The question that I have for you, and curious your thought, is it going to be like the iPhone where there's like an aha moment and everything changes? Or is this going to be one of those situations where kind of everyone on their own personal journey is going to find they have a need for that and they're going to be willing to engage? This is kind of a debate I feel like I've had for the last few years, and I'm curious your thoughts.
Well, I think the industry is so fractured in all the different players that participate in your healthcare. Understanding most individuals think, well, I go to my insurance company for seeing what I owe and what they're going to pay for, not necessarily finding who the right doctor for me is, maybe who's the right one that takes my insurance. So I think it's such a fragmented environment when you think about the physician that you see or the healthcare professional that you see, they're part of a group typically. And then you've got the facility that you went to, you've got your insurance company that's playing a role. It's very confusing and convoluted. We've been in this industry for 2 decades and still probably don't know every aspect and avenue. And so just think about those that haven't really been exposed to healthcare, either professionally or had personal stories that they've had to work through. It's very hard to navigate. Until we make that an easier process, I think we're going to continue to see the challenges in engagement. And it's going to be an aggregator of not just data, but understanding who you are, what your plans are, so that I don't have to go through 5, 6 different applications or one poor one that only gets a fraction of that information from me in order for me to do what I need to do. Accessing care through appointments, paying bills, whatever it may be.
It's interesting. I think my time in the business, which I'm coming up on 17 years, which just means I'm old, is basically what that means. But, I take any compliment I can get. So don't hold back on those. When I got in the business, the mentality was growing up on the TPA side, the payer side, the mentality was very much the client. And it was clear the client was the employer. And your distribution channel was benefit consultants and brokers, but ultimately the client was the employer. So at that time was very much, let's not make any investments into the member journey or member experience, because frankly, their decisions are irrelevant with regards to whether we retain customers. And I always felt like that was extremely myopic way to look at it, because when employers would partner with us, specifically on the TPA side, they were partnering with us to have more control and to ultimately manage and contain cost. Well, it was actually the decisions the members make that were dictating that cost. And that became very clear to me kind of early on when I was looking at claims data. The shift that I have seen around kind of associations and industry groups has been more and more focused pivoting towards the member, that if the member is not taken care of in a meaningful way, and it's really back to what we talked about at Value Health, which was we have to engage the member at the time that they need engagement, and they may not even know it. That's a challenging task to be able to do that. But I feel like there's been a shift in the commitment, which gives me hope. I'm a positive guy, maybe I'm naive, but I do feel like although the customer may not be the member to a payer, at the end of the day, that member is the reason that we go to work every day.
Yeah, and I think my experience broadly is this industry, all segments have very committed folks who work and stay in this industry. And I think that's because most do walk in every day with that being the realization of the person or the patient or the member. Those are the ones that we're really working for, regardless of what our role is in this ecosystem. I can probably count on one hand, if any, of bad actors I've ever run into over the course. There's certainly folks who have made decisions with unintended consequences. And I think that's a lot of what you described when you talk about myopic view of, okay, not everyone came into healthcare because they had a burning desire to go change the way that we as individuals experience healthcare in the United States. I think you come in with different objectives. And eventually, my experience has been the industry wins you over because you see the impact that can be had in your role as long as you understand your role in the broader ecosystem. But in such a convoluted system, it's really hard sometimes to see the forest through the trees, given all the different actors, all the different incentives, all the different kind of organizations that participate. But the one thing that stays consistent is that there's a person on the other end that needs help or is looking to go improve their life through their health. I think that personal connection is what drives many of the veterans who've stayed in for so long and who participate. I mean, and that is certainly true of the providers, those clinicians, those healthcare givers. I mean, that's where they started. So they have that dedication from day one. I think the rest of us that participate in different avenues eventually get to that realization is that individual connection is just so important.
I think that's the key of the whole thing. Those micro experiences are what keep us coming back, right? And knowing that we can make a positive impact and really get you starting the day in a way that you feel somewhat empowered with regards to that. I agree with you wholeheartedly. I don't believe I've ever met anybody in the industry who's entirely malicious. At the end of the day, there are some certain folks that certain things get in the way. That's for sure. Agreed is one of those, but those things happen. But it is kind of like the 2 or 3 golf shots when you play 18 holes that keep you coming back. You hit a couple good ones and the 70 bad ones. At the end of the day, those 3 get you coming back. So I think that's fair. And on some level, that provides hope, right? At the end of the day, that people care at that level. It's a massive problem we're all trying to solve or take one bite of the elephant at a time. But it is those positive things that really keep you in it.
I mean, and if you look back, my experience of the pandemic hit, one of the major kind of focus areas for me and from a product standpoint was telehealth and telemedicine, and had been slogging through that for years because it was something that everyone thought was cool. And that where we want to go spend our funds and our time and our effort in standing that up. And there were certainly early adopters. There were small pilots all over the place of people doing some really cool things. But what was impressive was pandemic hits, and all of a sudden, that is the number one thing everyone is asking about, all participants within the healthcare ecosystem. And it was pretty impressive to see how all the different players came together in some form or fashion, and how quickly they could go stand up and serve the needs of the public in a variety of different ways. Your technology providers, payers, government providers, certainly. I mean, it was incredible. I had a client who stood up in less than 48 hours. I don't know that those folks slept, and had telemedicine solution up and running. We're seeing patients like going and doing triage for COVID cases. I mean, immediately overnight, and something that prior to that, you would have planned out for weeks and months and still probably wouldn't have made it on time. So it's impressive to see the folks in the industry that how quickly, when the need arises, can shift. Now, I don't want another pandemic to prove that, but so how do we go get that type of acceleration and change, I think, is one of the big problems to go solve.
What are you seeing now that is going to drive some of this change and telemedicine to virtual primary care to all the other ways of engaging patients? Are we looking at more regulation?
I think policy certainly has an enormous role. If you look at our system overall, no one is satisfied with the role that they play within the healthcare system. Providers aren't satisfied with the way the system functions. Patients certainly are not. Payers are not. It's interesting to step back and look in an environment like this. No one is happy with where they're at in the system. I think policy has to drive major change within how we pay for healthcare, how healthcare is accessed, affordability of healthcare is. Just here recently, we're seeing enormous implications from an insurance standpoint with subsidies expiring, and you start to see the real life impact. If I'm a family of 4, I could be paying $2,500 to $3,000 a month for healthcare. Well, there's not many people in this country that can afford that type of premium for healthcare. So we've got to rethink how healthcare is delivered, how it's accessed, how it's paid for on a broad scale. And I think policy has to be a driver of that, and then let the innovators participate and accelerate.
The interesting thing, the data's never been better. Our ability to interpret the data has never been better. Technology's continuing rapidly, innovation standpoint. Yet we really haven't made leaps forward with regards to the actual goal, which is a more efficient system across the board for all stakeholders. It's interesting. You feel like we would be in a better position today than we've ever been to be able to take that leap. And like you said, with the pandemic, major leaps can be done. It's almost like we get trapped. When I say we, I'll say all the industry, all the stakeholders get trapped in, quarterly financial performances, reports, care of shareholders, which is important, right? They're stakeholders too, but ultimately kind of trapped in the quarter by quarter performance. This is not a problem that necessarily gets solved in 3 months, top to bottom, right? It's almost like there's going to have to be a collection of efforts and then buy-in across the board. And it's going to take a new system. I don't think it's as clean as, hey, we change a couple things and everything's on the right path. I think it's a bigger problem.
Yeah, I mean, I think it's constant change. We didn't get to this point because of some master plan that got laid out, and this is what we ended up. This has been built upon since the end of World War II. Talk about the insurance, health insurance, employer-based health insurance, kind of everything. It's a Gordian knot of an issue that how do we go get our focus areas apply the tools that we have, accelerate change with the end goal in mind of how do we make it affordable and accessible for everybody. But I think back to Ramesh's comment, policy has got to be a huge component of that, if not the driving component, in my opinion, and it's got to cross administrations. The pendulum can't swing so far in both directions with a change of administrations based on political affiliation or whatever. We've got to have some consistency. And the American people, if we're talking just in the US, the American people have to decide, like, what are the core values that we want in healthcare? And then how do we go prioritize those? I think policy and elections are one of the ways to do so.
One of the things that early on touched on, Andy, and I want to press a bit more, you talked about all of us now have to realize it's about the member, the patient. And the more we think about that and how we design the healthcare system around the patient, bringing everything in one place for them so that they're making optimal decisions. What have you seen working well? You also had it at Valley Health, the consumer engagement play there. What do you see must happen that is not happening today?
Incentives matter, both for the individuals, for the providers. And I think if you did a thought exercise of really stepping back and thinking through having a clean slate, I think you would see that a lot of the objectives align. Physicians don't want to churn and burn through patient appointments. That's not what they enjoy doing. They don't enjoy having 10 minutes to run through real quick, kick someone out and move on to the next. Like, they want to have a conversation and understand and use their skills, their knowledge, to go help that individual. That's what patients want as well. Like, so how do we incentivize that? I still don't think we've come up with a very good system for incentivizing both parties to create that experience. I think that's some of the experimentation that's been going on for well over a decade now around value-based care. There's other types of models. I don't think we found the model, but we've got to keep trying. And I think those are some of the aspects.
Yeah, without it, I actually think my physician, Dr. May, I think he actually wants to kick me out in about 5 minutes. Typical doctor actually, he's great. So in all fairness, I'm pulling him into this. It's a little unfair. He's willing to listen to me, which is appreciated. But one of the interesting things that what you say is exactly right. Nobody is kind of happy with the current system. We've got to keep trying. We went down the value-based care route, which is really a transfer of risk, is really what that is at its core, to physicians. And now we're at a place where we probably have the ability to do it. We were probably a little early back in those value health days, trying to get that pushed forward. But again, the data is strong, the ability to analyze it, creating an environment where the risk is manageable. I think all of those things have legs to that. I think the commitment of the system towards that in a meaningful way hasn't probably happened yet. I don't know if that comes via legislation or if that comes via innovative health system or something like that. But I also think across the industry, consolidation has been happening. I don't know that that's necessarily the worst thing for what we're talking about, because I do think it's an expensive thing to make this change. Somebody's going to lose through the process, and that may result in more and more acquisitions. I don't know. But I think, when I say lose monetarily, the system wins as a whole, and there'll be a place for everybody. And there's tons of money in this system at the end of the day. I do think there's got to be that level of commitment that's kind of pushed through, and it might be federal. That might be the answer of, hey, what we're doing here is unattainable. And the opportunities in front of us, the data shows it, and we're choosing as an industry not to take it one way or the other.
I mean, I certainly think government has a huge role to play, and I don't think we've figured that out, but I think it's certainly a role. There are things that health systems have taken on with help from federal funding and grants and other things like that, certainly. But it's a very convoluted, I wouldn't even call it opaque, because it's not, I can't even see that far into what's actually happening and driving some of the different mechanisms within the healthcare system. So taking a big long-term risk like that is challenging, but there's also components of private industry funding, of government funding. It's a convoluted kind of system. And I think we talk a lot about transparency, and a lot of the buzz 10 years now has been around price transparency for patients. I think transparency, period, in access, in payments, in quality. Those are all things we talk about North Star. Those should be things that we all understand and that the public can understand. It's almost like doing your taxes. I mean, it's such a convoluted system. You have to be an expert to know how to navigate it. And we've got to simplify that. It's made a lot of niches for a lot of players to go fill gaps to solve problems. But if you step back and looked at it, it's like, well, we've got so many different actors in this system who all stepped in to solve a very valid problem that we had. But now you've got to look at it and be like, man, how complicated does it have to be? It's very complicated as it currently stands.
I've got a question for you. I want to switch gears a little bit. You have a unique perspective. Obviously, you worked on the technology, the healthcare technology side at Cerner, and then you pivoted into Value Health. Probably didn't fully realize that you were heading into more or less the payer side of the business on the other side. And then you had to deal with me, who's a payer guy from time to time as well, which is painful. I understand. Talk a little bit about that difference, walking in and what you believed and then what you kind of experienced. And then as you grew in your role, kind of what you learned from that.
Sure. So I spent the bulk of my career working with providers and kind of looking at the provider and then the patient or the member ultimately as kind of the stakeholder there. Looking through the lens of provider and payer was a whole new world to me. One, I thought that I kind of understood it. I realized I did not understand that environment at all and all the complexity that's involved and how you pull a string or pull a thread and how much it's connected to when you go and look at it. You can't just go solve an issue in this one little area because you pull that thread and the whole thing unravels. So it was a very steep learning curve at first for me, but I think it also was great and I appreciated it so much and enjoyed it because I learned and gained a lot of experience from the eyes of a payer and of a provider and that interaction and that relationship, and then you'd apply it to what I learned over years in kind of the IT space. But I think it goes back to an earlier comment of there's a lot of folks in the industry that get tagged as evil or malicious type actors. And the reality in my experience, again, was that I just didn't see that. Now, I saw incentives being misaligned. I saw people making decisions because of the role that they were in without probably having appreciation or a knowledge of the bigger system and what that looks like. And you play that over in healthcare, transactions of millions upon millions at a time, bad things happen in very large volumes. And I think just the variation was astounding to me, how you could have the same providers, the same payers, the same patients, and then go look at that exact same actors in a different facility, say, and how vastly different everything worked. I thought that was news to me, certainly, and it took a while to understand it. But I think that variation just identifies or helps spotlight on the complexity that's involved and why then when you see that and you see the breadth of and the scope of what that is, you realize how difficult it is to then unwind it or to go kind of implement meaningful change in a way that doesn't just break a lot of things and create even more unintended consequences.
What's crazy is your experience. Mine was the other direction in a lot of regards, right? Starting on the payer side and then get an opportunity really through our time at Value Health to learn the provider side. It made unicorns out of a number of us, in all fairness. And I say that in the most positive way. That there's just not a lot of folks that have a basic level of even understanding of both sides. There's a lot of assumptions made. Like that's what I realized, growing up on the TPA side and working with that industry, it was very clear that the view of providers was of greed and inefficiency. And that's pretty much, we did a lot consistently. And so as I had the opportunity when we were acquired by then New Health and what became Value Health and got the opportunity to kind of work with providers kind of through that process and get closer and understand revenue cycle management and what happened prior to claims being created and all of that kind of fun stuff, just for being inquisitive of all of that, I realized that I was basically the Antichrist when I walked in the room, right? Coming from the payer side, like they viewed it as more or less unnecessary, convoluted, and the reason for costs to be high. And the crazy part of my whole experiences are both right. They're not totally incorrect on either side. At the end of the day, what came out of that was I do feel like I have a fairly decent perspective of both sides and I'm more empathetic kind of to the problems of both sides, as I'm sure you are as well with your experience. And that's just unique. There needs to be more of it. There needs to be more of that.
Until you kind of walk in their shoes and try to sit with them and understand what they're dealing with on a daily basis, it's challenging because A lot of times for someone, you walk up to see the big hospital. I mean, it's beautiful. There's these amazing facilities and things like that. And don't realize that, hey, everyone in that facility like isn't part of that system. And that's not necessarily theirs. And there's a lot of, like you said, there's a lot of assumptions aren't true when you get down into it. You live in someone else's shoes for a few days or longer. And so providers have a very tough job, and it's just more and more demanding on them every day. Health systems have tough job. They're a lot of times they're pillars of these communities. Like they employ a vast majority of the folks that live in the area. They're some of the bigger employers. They provide all the care. The payers are responsible. How do I go make affordable insurance so that people can have health insurance, that can pay for health insurance with some of the things that we're facing with rise in cardiovascular disease and some of these other areas that are very expensive, long treatment cycles, things like that. So, I mean, everybody's got, valid concerns, complaints, challenges. I do think we've got to have, again, going back to an earlier point, some overarching policy, some North Star elements of what do we want out of our healthcare system, and how do we lay out a plan to get there, and then use the advancements in technologies, the innovators to go accelerate that.
So you have this actors, as you were describing, peers, providers, nurses, clinicians, the hospital systems, the even healthcare providing some of the risk mitigation things, providers, and they all point to each other. There's a system kind of problem constantly, which kind of goes back to the value-based care model, how the incentive structures are working. If you were to fix a bit of that, where would you see in a cleaner system the role of that human? And how can we humanize this system so that the patient gets that human experience, albeit using the technology, the telemedicine and virtual primary care and other things are now out there?
I think we have to decide that that's what's important, is the patient, the person being at the center of what that system is developed to do, is to keep that person healthy, those that aren't, to address their health needs and get them on a path, kind of go forward. I mean, I probably don't have the answer of how do you go invest that, but I think that's got to be the mantra for all the different aspects of the system, is that it's to benefit that individual. And then you've got to overarching solve the problem of, well, who pays for it and how much, and how do you do that on a systemic basis, system-wide? Because I think you've got a lot of really good early indications that come from health systems running certain kind of programs. But then when you step back and look at it, it's like, well, they're doing an incredible job, but that's a very siloed, segmented population that they're doing it on. How do you broaden that out? And these are big problems, big solutions that are going to have to be a part of it. But having the person at the center of it, in society, we've got to get back to an understanding around empathy. Like, we view sometimes as claims and dollar amounts, patient ID, not as your mom or your dad or your sister. You look at how frustrating that can be. You got a lot of folks that would love to, they get stressed out if they get a bill saying that they owe something and they don't know why. It takes 60, 90 days a year for insurance companies and providers, to negotiate. And, I recently had a scenario where received services, there was a contract dispute with the provider and the insurance company. They were out of network. So I paid out of pocket. Well, then everything got rectified and was retroactive. And so then the insurance company paid. Well, nobody notified me that, hey, I paid for it, and now the insurance company paid for it too. And I had to go back and find it. And so when we talk about ballooning costs of healthcare, stuff like that, it's not greedy surgeons who are charging so much or insurance companies. I mean, you can probably draw some element of that to a degree, but I mean, overall, it's just, it's setting ourselves up to fail because it's so complicated and convoluted and layers upon layers how healthcare is delivered and paid for.
Isn't it crazy that we're in 2026 and that for a good turn time for services rendered to claim payment, an acceptable turn time is 45 days from the time the services are rendered to the time that provider gets paid with the coinciding EOP that marries in the revenue cycle system. 45 days. That's acceptable large regional insurance company turnaround times.
It's one of the few industries where the person receiving the service and the person providing the service, neither one knows what they're going to get paid for that service. what they're going to pay or what they're going to get paid. If you had no prior knowledge, it would just seem absolutely ridiculous that that's the system that we're in, but it is. And there's a lot of reasons, a lot of valid reasons why we got here. I think it's time to reevaluate.
It's like the Wizard of Oz. Pay no attention to the man behind the curtain. It'll all get taken care of, right? Andy lives in Kansas City, if you don't know. So we'll mix that in. Wamigo, great museum for the Wizard of Oz.
And I know you're setting up a coffee shop too, Andy, is that here?
I loved my time that I've had kind of in the healthcare industry. I've worked for a very large corporate, organization, a very small kind of early stage company as well. From an experience standpoint, I really kind of felt the draw and the need of, I wanted to experience local community, small business kind of ownership as well. Also had young kids, was fortunate enough to be in a position where I could take some time and spend with them, which has been fantastic. So I exited almost 2.5 years ago now, pursuing a variety of different projects, coffee shop being one of those, kind of community interaction and things like that have been really rewarding. And at the same time, circling back around has a whole nother viewpoint of healthcare and the health system. Recently got my health insurance off the healthcare marketplace, which when you look at that environment, compared to employer-based insurance and other opportunities that were out there, it's pretty disappointing, honestly, overall. Affordability aspect. And I look at it as, we can make this work for my family. We're fortunate enough to do that. How does anyone else do this? It is insanely expensive. The networks are incredibly narrow. We've got a local facility that did not accept a single marketplace plan. How do you operate and not accept a single marketplace plan, a market for all those folks who need, that's really their only option, their only alternative. So it's kind of given further perspective as an individual small business owner type, which makes up a large portion of this company or this country and what their situation is. And I just think we owe it to each other to have a better system than that.
So there you have it. We have a very complicated system. We have incentives. We have people pointing to each other. Hopefully, we won't give up.
There's light at the end of the tunnel. I'm with Dallas on this. Like, they're maybe naive, but we can identify all the problems. The solutions seem big and undefined. The dedication of people and people in general are good at heart. They want what's right. And I think we can get there as a country, as a society. I think we'll make that turn. And if anybody can fix it, we can. So I'm optimistic. It's going to be hard work.
Ramesh, I got to tell you this story. Like, I'm a volume coffee drinker. Baristas hate when I come in. I have to be the most boring. I just would like a cup of black coffee, hot. It goes back to the old college football coaching days where we had coffee and water. Yeah, I gained an appreciation. And I tell you what, it hasn't gone away. But I didn't realize there was other coffee that arrived at a different level. And Andy brought in a little thermos, and I won't call it little thermos. And he's like, I'll bring you some. And he brought in this little thermos, and I was like, this is it. And then I took a sip of this thing. It was like I arrived in the middle of like filling an ISO as a linebacker against Ricky Williams. I mean, this thing was, and ran me over. I mean, my eyes were wide open the rest of the day. It was wonderful. The taste was amazing. It was great coffee. But, oh man, was I not prepared for what I got. We had to bring Ricky up since he's a Texas grad over there.
Well, this has been great. Thank you, Andy, for taking the time and sharing some of the really, developments and thoughts on where healthcare is headed, what is really needed, and some of the underlying stories here.
Certainly appreciate you guys asking me to participate. Keep doing what you're doing, and everybody else in the industry will too. And let's drive forward, drive some change.
That's right. We'll make it happen.